welcome to a slightly wet but a very beautiful Suffolk nonetheless. So as Jenny said, my name's Tessa Lindfield and I'm the new Director of Public Health here in Suffolk. And people often ask me about my job, saying, you know, what does that really mean, public health? Like, what do you do? And public health is all about the health of populations and the variations between different groups within that population. And in the UK, every geographical area, every county has a Director of Public Health with a department similar to the one that I work in. So my job's all about improving the health of the population of my geographical area, which is now Suffolk, and decreasing the unacceptable variations that we see between the health of different communities within that population. And sadly, these variations are seen in almost every health statistic that you look at. If you're born today in the poorest neighbourhoods in Suffolk, you're unlikely to reach retiring age in perfect health. And that's in contrast to our most affluent neighbourhoods, where your disability-free life expectancy, so the number of years that you can expect to live disability-free, is 8 years more than in our poorer neighbourhoods. So it's really fantastic to see so many people here today, and people from so many different organisations. And I really mean this because we need your help. We have a really big agenda here. And we need your help because we're facing something of a perfect storm in public health, something that we've never seen before. And in some ways, we're victims of our own success. If we were sitting here 100 years ago, quite a few of us would be dead by now. We'd have had TB. Yeah, we would. We'd have had, some of us would have been dead from TB, from asthma attacks, from measles. And so we've managed to make real gains in those things. And we've done a really good job of completely eradicating some diseases and making treatments better and much more accessible for others. And that means that we're living longer and longer. And even in the last 10 years, we've seen huge changes in survival from heart disease and stroke and cancer, which are the main diseases that kill us early. And we're even making slow but steady progress in tackling one of the main threats to public health, the scourge of public health, smoking. But there's a persistent problem that we're not making any headway on, and one that really threatens our future health and well-being. And we're seeing more and more of us, more and more people, living really unhealthy lifestyles. As a species, we seem to be fundamentally quite sedentary. We've drifted towards a lifestyle of sitting around for hours and hours at a time. The average is 7 hours a day for adults. We buy larger and larger clothes to cover our expanding waistlines, and we take more and more pills to manage the resulting diabetes, high blood pressure, depression, etc., etc., etc. The list goes on. And the figures are quite astonishing. In Suffolk, which is a comparatively healthy part of the UK, 65% of men, that's nearly 2 in 3, are overweight or obese, and 50% of women, half of all women. And we know that this increases our risks of colon cancer, of breast cancer, of heart disease, of diabetes, but we haven't found the answer to changing our behaviour. We haven't found that key to change. And we haven't found the thing that will really make a difference. And the numbers of heavy people isn't really surprising when you look at our levels of sedentary behaviour. 30% of adults in Ipswich, which is a more deprived part of our county, do no exercise at all. And that's 26% across the whole county. It's not that much different. 1 in 6 people in Ipswich say they do 30 minutes of exercise 3 times a week. And in other parts of the county, it's slightly better, but not exactly impressive at 1 in 4. We hold the unenviable position of being 25th out of 27 shire counties in England for levels of activity. We seem to have designed out activity in our society. We have washing machines to do our laundry. We have powered lawnmowers to mow our grass. And we don't even walk around the shops anymore. We get really mad and complain if we can't park our car right outside the office or right outside the out-of-town Marks and Spencers. And this is where that perfect storm hits, because we have this cohort of adults leading unhealthy lives. And it's a large cohort, it's a large number of people who are likely to live well into old age, but are unlikely to be quite healthy enough to really live the life they want to lead. And at the same time, those resources that we have to care for those people as they get older are diminishing. Never mind austerity, we're talking about the fact that there will be fewer taxpayers, young working age people, to pay tax to pay for the resources that will be needed to look after us when we get older. So this future generation will need to keep working for longer, and we will want them to keep working for longer in our businesses. So we all need this cohort of future older people to be independent and healthy. And to achieve this, something needs to change, and it needs to change now. And this is a particularly urgent issue for Suffolk because our population in this county is growing faster than other parts of the UK. We're an attractive destination for people like me who've just moved here and who move in their 40s. Because it's such a wonderful county, we stay. And our population of older people is rising even faster than our general population. It's an attractive place to retire to. And at the moment we have about 1 in 5 of our residents over 65, but by 2031 that could be as many as 1 in 3. And we have a particular characteristic in Suffolk that has its own challenges, in that our older people tend to live in the rural areas rather than in the towns. And that's why we were so pleased to be successful in our bid to the EU for the Progress Project, which is the sponsor for today's event. Because we're not alone in facing this perfect storm in Suffolk and in the UK, it's happening all across Europe. And Progress is a really important piece of work which aims to identify the benefits of healthy and active ageing, to be able to develop new, innovative, sustainable approaches to health right across the EU. The lessons that we can learn and share in Suffolk are likely to be useful in lots of other countries that are facing the same challenges. Now, we're not starting from a blank page here. We already have some really good work going on in Suffolk. Organisations like Healthy Ambitions Suffolk, they have this really fantastic health manager tool which helps people manage their own health, as well as giving employers information on approaches which could be useful. And we have an excellent local academic partner, University Campus Suffolk, which is working with Healthy Ambitions to evaluate the project and gather insights into the approach. And that's just one of lots of really good things that are going on locally. Now, I mentioned that this perfect storm is partially a result of public health success, and my hope is that today will be another major success towards the next big step for public health. Because if we want active older people, then we need to start with people like me in their mid-40s, people who work too hard and are getting less and less active as they get older. And a logical place to start is the place where we spend a huge amount of our week, the workplace. Earlier, I mentioned how we seem to have designed out activity in our day-to-day lives, and today I want to think how we design it back in. If we can do active ageing, then we'll not only be able to live the lives we want to live, but we'll be better employees, building businesses in Suffolk and able to give back to the communities that we live in. We know in theory what we need to do. The chief medical officers in the UK came together last year and produced a really good report called Start Active, Stay Active, and the report makes it really clear what we need to do. The recommendation is that we do at least 150 minutes in bouts of 10 minutes or more of moderate activity spread across the week, and that's where that 5 times 30 minutes recommendation for exercise comes from. And we also need to do 2 episodes of muscle strengthening in the week. Now, I'm not talking marathon running here. I can't run a marathon. And I'm just talking about getting your heart rate up a bit, getting a bit sweaty and a bit out of breath. Something like a brisk walk or digging the garden, rowing a boat, game of rounders, that sort of thing. We're not talking elite sports here. We're talking just getting a bit out of breath. So what we need your help with today is how we can use the workplace to get that theory into practice, to get healthy living really into people's lives for the long term. My expertise is the theory. Yours is running successful organisations that really employ many people across Suffolk, and people who work better if they're well. And together, I think we could be a winning combination here to really tackle this issue. So my job is public health, the health of populations, and a particular bugbear of mine is how many public health decisions get made behind closed doors. And one of my colleagues coined a really lovely phrase, and I'm going to steal it today, because today needs to be different. Today we've really got the chance to put the public back into public health. I'm very much looking forward to putting our heads together today so that we can really nut out this issue of healthy ageing at work and see if there really is a business case to be made for it. I think this is the start of our winning combination to really find new things to do and new ways around the obstacles to healthy ageing at work. And I'm really looking forward to it and looking forward to us working together. Thank you.